anatomy of the eye, highest number of questions have been asked. First is, what is volume of eyeball? Don't think you can imagine it in the exam hall. You may have Meenakshi's in the exam hall, some with big eyes, some with small eyes. Where will you calculate? So 6.5 ml is considered to be the volume of the eyeball, is what you need to remember. Typically the eyeball grows very rapidly. It reaches by around 23 millimeters by diameter by 3 years of age. And by age 13 it will achieve the adult size, the eyeball, and the volume is about 6 cubic centimeters is what you have to ultimately remember. Retina has many layers. What are the layers? And in which layer do you find the presence of acetylcholine secreting cells is a very important question. So in the inner plexiform layer you have amacrine cells, which are the ones which produce the acetylcholine. A for acetylcholine, A for amacrine cells. A means under means inner plexiform layer. You can easily remember. Now, what are the various neurotransmitters in retina? We have glutamate, which is used by rods and cones and all bipolar cells and the ganglion cells. Then GABA is used by amacrine cells. Glycine is used by once more amacrine cell, and dopamine also by amacrine cell. So what is the only word you can remember with the minimal white matter left over in your brain after so many subjects? Anything amacrine bolo, mukti mil jaye. So then doctor, whenever photoreceptor is stimulated, what will it release is a very important question. Photoreceptors are rods and cones. So it is the glutamate which is the important neurotransmitter which is being released by the rods and cones. What is Schwab's line? Schwab's line is the posterior limit of the Descemet's membrane of the cornea. Cornea has many layers, right? So we will also go through what are the layers of cornea down the line and the layers of the retina. So if you look at the cornea, sclera means white, no confusion, because people have confusion between conjunctiva, sclera and cornea. I think you all are very sure what is uveal tract. Iris, ciliary body, choroid is called uveal tract. Retina is not part of it. Why I am saying this is, in MD, while doing rounds, suddenly neurology professor asked, hey, what is uveal tract, man? Suddenly that is a very unexpected question. There was a case of Retus, and the same patient incidentally required a neurological consultation. So they were having rounds. So, oh sir, uveal tract means first it is in eye. What is anterior and what is posterior uveal tract, man? Oh, there are also two things, no? So we started from conjunctiva, cornea, sclera, whatever name is coming is all anterior. So I see. So then you mean to say retina is posterior uveal tract? So the more mistakes you do, the more examiner will drag your foot until you enter into that cave fully inside the crocodile mouth. So it's always enjoyable. In throwing stones in the ward rounds for the professor's questions is the most memorable part of the medical student life. So Descemet's membrane ends at the anterior limit of Schwab's line, and Schwab's line, that's the reason, forms the posterior limit of the Descemet's membrane is what you need to remember. Descemet's membrane is one of the layers of cornea. So obviously cornea is a structure where front of it is the world, behind it is the retina world, posterior and anterior aspect. So Schwab's line typically ends along the posterior aspect of the Descemet's membrane. Now in the lens, what is the thinnest layer, thinnest part? It is the posterior pole of the lens which is considered to be the thinnest part, but not the anterior pole. Then obviously examiner want everywhere where is the thinness. Sclera is thinnest in which part of the entire sclera? So it is thinnest at the point where the rectus muscles are there, the extraocular muscles. They insert into the white coat of our eyeball. So the point where they are inserting is the thinnest part of the sclera is what you need to basically remember. So summarize doctor for the tomorrow's exam, straight same question also will come. There is no surprise because until human civilization will be there, thinnest part will be posterior pole only. And anyway, we are not planning to take entrance exam until civilization ends. This year is the end. So thinnest part of lens is posterior pole. Thinnest part of sclera is the point where the rectus muscle is inserting. And what is the thinnest part of retina? Fovea centralis is the thinnest part of retina. So the thin, slim looking parts of the eyeball you must be very quite sure about. Now in this context there are two surgical anatomy points in relation to this thinnest parts. Unlike many other ophthalmic surgeries, whenever you are passing a scleral passes while doing strabismus surgery, it's like a drainage. You usually perform that at the thinnest point of the sclera. While doing strabismus surgery, when you need to pass a scleral pass, then you will choose the point of insertion of rectus muscle into sclera, because that being the thinnest part, which is only 0.3 mm, that is a point where you pass the scleral pass. Similarly, posterior pole of the lens is the thinnest part. What is the surgical anatomical perspective of that? If you look at the cataract formation in the posterior pole of the lens, lot of times cataract forms along the posterior pole of the lens. The reason is, in the posterior pole of the lens, there is a missing epithelial barrier. Because of that, the cataract formation is much more commoner along the posterior pole of the lens rather than on the anterior pole. That's the reason you should remember posterior pole is the thinnest part of the lens, is what I want to underscore. Then what is Berger's ligament? That means you understood now. Out of 10 questions going to come in ophthalmology, 1 is going to come from anatomy. Anatomy of the eye. And it's very easy to master anatomy of eye, not a big deal, if you know what is uveal tract, right? So, typically if you look at the vitreous, given the board. In the eyeball, you are having retina in the behind, here you are having the lens, and in the middle you are having the vitreous. Vitreous is like a gel. It needs to basically attach at various points to the various structures of the eye. So obviously which aspect of the lens it needs to come and attach? Posterior aspect of the lens. So basically the point where vitreous attaches to the posterior aspect of the lens, it is called as Berger's ligament, is what need to be remembered. Now let us see. This is the lens, and the point where the vitreous is attaching, that is basically called Berger's ligament. In the same place there is a space created which is called the space of Berger. Berger's ligament, space of Berger are along the posterior aspect of the lens. That's a point of interest. Once more you can see here, If you look at the vitreous, the point of its attachment is basically what? The Weger's ligament along the posterior aspect of the lens, and this is the place where you have the Berger space. So, what is Berger space? You have a hyalocapsoid ligament or the Weger's ligament. So, the central part of that Weger's ligament has got a space which is called as Berger space, is what you need to basically appreciate. So, why all this basically happen? If you know the embryology, you will be able to understand what is Weger's ligament, what is Berger space, etc., etc. So, in the embryological development of the eye, there is vasculature in the eye, there are muscles inside the eye, there is a lens inside the eye, there is a retina inside the eye. So, during the fetal time, when the development of the eye is happening, initially it forms like a sponge of vessels. Later on, lot of vessels will dissolve. Only those vessels like anterociliary vessels, etc., they remain patent, and many will dissolve. Sometimes there can be a persistence of the fetal vasculature. Whenever the fetal vasculature persists, then it leads to formation of some amount of a vestigial remnant inside the vitreous, and that structure which is being left by it is basically called the Cloquet's canal, which leaves a Berger space. And how is this Cloquet's canal is passing? It is passing through the vitreous as a persistent hyaloid artery which did not dissolve as a vestigial, is what you have to fundamentally appreciate. So, Cloquet's canal, Berger space, and Weger's ligament. Now you have a clear cut idea as to what these structures basically. This is a fetal eye. In the fetal eye you can see the hyaloid artery and its branches which are passing, which have not yet degenerated, being still patent, and whenever they become vestigial, then what you get is called as Cloquet's canal, is what you should remember. Sometimes on the posterior surface of the lens, there may be a remnant of this Cloquet's canal, hyaloid artery, which may be left over like a speck, and that is called as Mittendorf's dot, is the name which is being given for that speck of the hyaloid vessel in the back of the lens, posterior aspect of the lens. So we are only adding terminology to our mind, that's all. Cloquet's canal, Weger's ligament, Berger space, Mittendorf's dot. They are the 5 things you need to basically, 4 things you need to remember for the tomorrow's exam. Then doctor, out of all this, which is the sensory layer of retina? Obviously rods and cones are the ones which are reacting to the light. So day after tomorrow when you come for the physiology class, Dr. Kulkarni explains you the visual cycle, rhodopsin, etc., etc., which is the favorite topic in physiology. What happens to various sodium channels, etc., will they close at the time of hyperpolarization or depolarization? All those funda of the visual cycle, you don't read anything physiology also, you can cut that page, read and go to exam. One question is assured, one question will definitely come. Now what is the sensory layer? Rods and cones. Now tell me doctor, what are the layers of the retina? One way to remember is some stupid mnemonic to remember, that's the only way. Naturally only you can remember, better remember. In new generation it is only ophthalmologists examine patient's retina. In the old generation MBBS doctor only used to examine. Case number 1 he used to do a cervical examination. Case number 2 ocular examination. They used to be like entrance preparing students. So nowadays only ophthalmologists are seeing. So that way in new generation it is only ophthalmologist examines patient's retina. Eye is inner limiting membrane, nu is nerve fiber layer, generation is ganglion cell, inner plexiform, inner nuclear, outer plexiform, outer nuclear, external limiting membrane, and then you have photoreceptors and the retinal pigment epithelium. That is how you need to remember the various layers. I think instead of a mnemonic it is more easy to remember. First is pigment, then comes Rods cones, because Rods cones cannot be projecting out of retina and say that we are here. So there must be some pigment. That's how choroidal melanomas will form. Right? Melanoma forms in choroid. Choroid is an extension of retina. So first pigment layer, then rods and cones, then go inside. You have a external limiting layer, outer nuclear layer, outer plexiform, then inner nuclear, inner plexiform, then ganglion layer, nerve fiber layer, inner limiting membrane are the ways if you go from front towards the back. Out of this, which is the sensory layer? Rods and cones is the sensory layer, is what you have to basically remember. Now, what is meant by optic disc in the retina? There is one point where the retinal blood vessels enter into the retina. That point where they enter is basically the optic disc. It is the same point where optic nerve leaves the retina and the blood vessels enter the retina. The toll gate is there, no? That is basically what? Optic disc. And where is the optic disc located? It is typically, eye is a globe. Globe has an anterior aspect, posterior aspect. So it is not along the anterior part of the globe but posterior aspect of the globe. So typically it is located around 3 millimeters medial to and slightly above the posterior pole of the globe. You imagine a global structure. Posterior aspect will have a posterior pole. So it is typically above it, medial to it, around 3 mm medial to the midline, I mean to say, is the typical location of the optic disc. But what is optic disc means? The point of the retina where blood vessels enter and optic nerve leaves is basically called the optic disc. Then whenever you do ophthalmoscope, you will see the moon in that beautiful sky. Who is that moon? Optic disc. If you see full moon and a big optic disc, you are worried, right? In papilledema, right? So that strikingly visible circular thing in the fundus examination is the optic disc, is what you need to remember. Then one more thing about the optic disc is, you have rods and cones throughout the retina, but typically if you come to the optic disc, the point where optic nerve is leaving and retina, blood vessels are entering, there are no visual receptors in that, only in optic disc area. So that is the reason what is optic disc is also called blind spot, is the other name which is being given for the optic disc. Of course you know all these things, but there are some underprivileged aspirants, including me, who is learning for the first time. So that can also happen, that situation can happen. In anticipation with that, I am trying to talk where is optic disc, what is blind spot, which we studied in 9th class biology, actually speaking. Now, what is pigmented neurosensory epithelium of retina was the question of DNB. Typically, the non-pigmented epithelium of choroid continues to form the neurosensory retina, is what you have to basically appreciate. So retina and the choroid, and choroid comes forward to become part of uveal tract, where you are having iris and ciliary body. So it's all a continuum. You have an idea. In the front iris and ciliary body, then choroid, and then ultimately merges into retina. So that's the reason the neurosensory retina of the one of the retinal layer continues as the non-pigmented epithelium of choroid. Now, the center of the macula lies. How many disc diameters along the temporal margin is a very important question. Already we discussed where is the optic disc located. Around 3 millimeters medial and above the posterior pole is the typical location of the center of macula. Now there is a point which is called as fovea centralis, otherwise called central fovea. In the center of macula, there is a point, there is a pit-like location which is called fovea centralis. It has got no rod cells, but it has got high density of cone cells, and cones are associated with what? Color perception, and also for the fine details of whatever we are visually seeing at the things. Then fovea centralis is the place, unlike the other part of the retina, there is no interference of any blood vessels. No blood vessels will come and interfere the fovea centralis part. So that is the reason it is responsible for the perception of the sharp and detailed outline of whatever that we see is the fovea centralis. So fovea centralis has no rods, but it is highly rich in cones is the point of interest.